All right, so we will continue with just go a little bit deeper into case conceptualization because it must happen. It must be done well before we can get to the idea of treatment planning. So let's just go over a few of those steps. So the initial assessing process is considered within the realm of case conceptualization. Conceptualize what's happening with that client that's before you. So of course we're going to listen. So this goes into intake, all of those processes, and in your in this module I uploaded we uploaded a handout about solar, and we talked about that before, but we uploaded another document just to remind you, because in this process you must practice that posture, that clinical posture that solar invites you to do in order to be able to assess well. So you're going to listen to the client's story and their presenting problem. What is the problem? What is the concern that the client is bringing here to the clinical environment, to the therapeutic encounter? After that, you're going to gather the information about how the client perceives his or her world. So you get the details, right? The objective details of the facts or whatever. Then you got to dig into perception. So this is what's happened, but how do they receive it? How do they perceive it? 3, you obtain demographic information, because the demographic, their social environment, all of those demographics matter, the age, and education, social economics, all of those influence mental health. Then we're going to look at social, historical, and cultural context, all which influence mental health. You're building a picture here. If you can see it, you're building a picture of putting your puzzle together. Assess the client's strengths. This is important. Strengths must be included in treatment planning. We must assess that and include their strengths, build on their strengths when we're building a treatment plan. That's really important. And coping skills, what is it that they use automatically as their coping skills? Assess for risk, right? What risk are there? Create a problem list. That's often missing from a treatment plan, is the problem list. So we want to assess for risk. And then we'll go on into, usually this will lead us to a diagnosis. We'll get to the diagnosis, and it depends on where you see this. Sometimes you'll actually see diagnosis in front of this, which can be a little confusing. But so we're just going through this process. So after we gain this picture, we're generally able to say, okay, these are the signs and symptoms we got. Diagnosis fits here. Then we go really from this point into the treatment planning process, where we apply. Very often we will need to apply a theoretical orientation and hypothesize about the nature of a problem. So once we apply theory, we're able to hypothesize, because person-centered therapy or theory says that if we have certain conditions that are present when we're engaging the client, we increase the likelihood of their wellness. Now, this is what the theories can purport. This is why it's often necessary to do treatment planning within the context of a theoretical notion or a theoretical foundation. So we apply theory, and then we develop goals, interventions, and of course I talked about measurement, your signature, and there's always an ongoing process. There's an ongoing process within treatment planning.
So as you guys are going through and actually doing the study portion for the NCE, what I want you to bring your attention to on the slides is basically where, as Dr. James talked about, the process of conceptualization, the gathering of the information, the biopsychosocial information, and as you're doing those assessments and all of that, what you need to pay attention to as it relates to the NCE, or a portion of what you need to pay attention to as it relates to the NCE, is the sections in which those fit in. So as you talk about like the social, historical, and cultural context, that is in for the KCREP section that fits in is the social and cultural concepts. When you talk about the obtaining demographic information, so that is going to be in the helping relationships portion of the KCREP sections. That piece there will be that would be a helping relationships question. Then there was something else that I wanted to make sure that I mentioned. When we talk about the diagnoses piece, remember that that's going to be in where the NBCC's domain of intake and diagnosis. So you want to make sure that you are understanding where those fit within those domains, so that will help guide your study as well.
Okay. Let's see. Just a couple of more pieces. We want to make sure that we're using clinical thinking skills to manage the change process and ultimately leads counseling and mental health professionals to treatment planning. And so the idea of the change process, I provided you with a handout that walks you all the way through each of those steps through the change process. Treatment planning is required for professional competency. Absolutely. There should be no clinical practice occurring without the use of a treatment plan. Otherwise, you are basically the blind leading the blind. If you don't have a plan, you're not honoring the process and you're not functioning ethically. So you must have a treatment plan process. Who benefits from treatment planning? The client and the counselor, Absolutely. The mental health profession, and third-party payers. Because if you got a third-party payer, they want to have some expectations of what is to occur. For treatment planning to be effective, each plan must be tailored. So we're summing here a little bit. Tailored to the individual client problems and needs, and all must be considered in developing the treatment plan. So their individual strengths and their weaknesses, their unique stressors, their social network, their family circumstances, and their symptom patterns. And these are in your slides. All right, and that's really about it for the treatment planning. Let's round it out with just saying, make sure that you understand what behavioral definitions are. And that slide is there. But if you've got Joxma, he gives you examples of behavioral definitions. And so that's about it for treatment planning.
So as you go and you work through your areas of treatment planning, take some time out and figure out where the treatment planning fits in those K-CREP models. Even though there's only, I think it's 14 questions. Even though there's only 14 questions, if you understand where those fit, both in those K-CREP, in the K-CREP model, and then you can be able to understand these pillars of treatment planning, then you can put all of that together and have the information to pull from when studying for the NCE and being able to use that deductive reasoning to answer those questions. All right.